National Colon Cancer Awareness Month, and cases are rising among younger people, and screening is key for early detection and prevention. And here to discuss this is Dr. Babia Akari from Mercy's GI Clinic. Dr. Akari, thanks so much for being here today.
Thank you for having me.
Yes, absolutely. So we'll start with this first question here. So of course, we've traditionally thought of, colon cancer being a disease for older people, but now we're seeing an increase in cases among younger people. So what are we seeing behind this trend?
So there are multiple factors. Lack of physical activity, more sedentary lifestyle, obesity, increased consumption of processed foods, processed meats, smoking, alcohol, and then underlying genetic and environmental factors.
Okay, and so at what age should people start thinking about getting screened, and are there certain risk factors that might require earlier screening?
Sure. So the age that's currently recommended to start for an average risk individual is 45 years. This used to be 50 years, but the guidelines were updated and changed to 45, given the uptick of increased cancer in younger adults. There are risk factors that need to be looked at. So some of the risk factors that I would recommend looking at is family history of colon cancer, family history of any underlying genetic mutations, family history of advanced polyps, if someone has history of inflammatory bowel disease or history of abdominal or pelvic radiation, then talk to your primary care physician and see if you need to start your screening colonoscopy earlier.
Yeah, right. And so what are some of those different options, of screenings that are available, and what's the gold standard for detecting colon cancer?
Sure. So the options, there's, of course, colonoscopy. And then so there are some stool-based tests. There are some newly available blood-based tests. And then there's also CT scan or imaging modalities available.
Perfect. And Dr. Akari, so what message do you have for people who may be a little hesitant to get screened?
Okay. So, colonoscopy is the gold standard. I do recommend that you do get a screening colonoscopy because it not only detects or helps diagnose a lesion, you can biopsy and remove a lesion before it turns into colon cancer. Colon cancer is one of the most common cancers in the United States. It's also one of the most common cancers that cause death in the United States. So, and it's preventable. So I do recommend getting screened.
No, absolutely. All right, hey, well, that's all the time we have. Dr. Akari, thanks so much for being here today.
Thank you for having me.
Absolutely. Okay. And stay with TV9. We'll be right back.
Your trust.